Bismillahirrahmanirrahim. I am Dr. Shadba Naeem here today to present my abstract, which is about risk factors contributing to in-hospital mortality of patients with advanced chronic liver disease. The study was being conducted in Jinnah Postgraduate Medical Center, Karachi, by myself, Professor Syed Masroor Ahmed, Dr. Zishan Ali, and Dr. Maryam Wakar. So basically, ACLD is known for its high risk of mortality, especially when associated with acute decompensation like upper GI bleed, ascites, encephalopathy, or hepatorenal syndrome. Due to poor outcomes for hospitalization for advanced chronic liver disease, identification of risk factors and their management is very important to take into consideration so that the number of mortalities are reduced. ACLD occurring due to liver fibrosis and cirrhosis is characterized by portal hypertension and derangement in liver functions. People with decompensation are not capable of performing all its normal function. MELD sodium score assesses the severity of ACLD using serum bilirubin, serum creatinine, INR, and sodium to predict prognosis. So the objective of the study was to determine the risk factors contributing to in-hospital mortality of patients with advanced chronic liver disease. It was a cross-sectional observational study. The duration was 6 months. There were 209 patients with confidence interval of 95%, and it was conducted in Medical Unit 3, Ward 7, Jinnah Postgraduate Medical Center, Karachi. The patients included were all the consenting patients between the ages of 12 to 80 years who are known case of advanced chronic liver disease admitted in our ward. And the patients who were excluded were the patients with comorbidities like congestive cardiac failure, end-stage renal disease, stroke, CNS infection, and patients with malignancy like hepatocellular carcinoma were not enrolled in the study. So this is a table showing the baseline quantitative characteristic of the sample, which consists of gender, the causes of decompensation, temperature, and CTP score. So it was found out that there's a significant association of gender and Child-Pugh score. The number of patients were 59.1% were females, and CTP score was 52.3%. These are the baseline quantitative characteristics of the study sample, and it showed significant difference in median value of age, respiratory rate, white blood count, total bilirubin, direct bilirubin, sodium, potassium, and MELD sodium scores. It was then found out that the odds ratio with 95% confidence interval was studies for risk factors of mortality. In univariate sample, it was found out that samples with older age and high MELD score were associated with high mortality, whereas gender and high sodium values had negative association. Whereas in multivariate model, systolic blood pressure, platelets, and potassium give positive association, whereas sodium gives negative association with hospital outcome. So we concluded that patients with advanced liver chronic disease must be monitored closely with lab parameters to prevent mortality caused by the risk factors.